Welcome to Discovering Health, presented by Covenant Health Plainview. Your host for the show is Chris Moore, alongside various medical staff and health-related professionals. For the next 30 minutes, Chris submits the questions to the professionals that you have emailed in and discuss the topics that you want to know about. Now it's time for Discovering Health, presented by Covenant Health Plainview and Chris Moore.
Good evening. You're tuned into 103.9 FM, The Pulse. It's 5 o'clock, and it's time for Discovering Health, brought to you in part through the courtesy of Covenant Health Plainview and South Plains College. My name is Chris Moore, and joining me for today's program is Dr. Ruth Rector-Wright, family practitioner with Covenant Health Plainview. Dr. Rector-Wright, thank you so much for being here.
Well, thank you for inviting me.
Yes, it's great to have you. I know you've been busy, crazy schedule, and just appreciate you coming in this evening. Hey, just a couple of things. How long have you been in Plainview? How long have you been in practice? Tell us a little bit about yourself.
I've been in practice for almost 30 years now. I've been in Plainview since my daughter was born, which is about 26 years.
Wow. Okay. So what brought you, if you don't mind me asking, what brought you to Plainview?
My husband's family lives here, and so we came back to be closer to his family.
Okay. Well, great. Well, good. Well, thanks so much again for being here. And I'll tell you what, folks, we are going to be going in here and we are going to be answering questions that you, the listener, have sent in by way of email. And so let's get started right now. First off, dear doctor, I'm a new mother. Recently, my son had a fever of 100 degrees. It eventually went down, but in the future, what temperature should I consider taking him to the hospital?
It's different according to the age of the child. A child that is under 2 months of age, you worry a little bit more about a temperature, especially if they have a fever above 100.8. It's not so much what the temperature is, but it is what the child looks like. If the child above 2 months of age is eating and drinking and laughing and playing, and you give him a little Tylenol and he is acting even better, then you can wait until the next day and take your child into his local doctor.
Sure. And I know some kids are different than others. I know that I had one child, and by the way, you are our family doctor, and one child, if they had just the smallest little bit of fever, man, you could see it all over them. They were down and trodden, and you could just tell they felt bad. The other one, they could have 100.8, 101 degree temperature even, maybe a little fussy, but you really couldn't see it so much. I guess it's different with every kid, right?
Yeah, it is really different with every kid. And, the thing that you can do is go ahead and give them a little Tylenol. And after 6 months, you can give them Motrin and see how they do. If they're eating and drinking, not vomiting, not having diarrhea, and acting fairly good, you can wait until the next day. However, if you have a child that is lethargic, is not responding to what you are doing, then it is important for the child to be seen right away.
Okay. And when you say right away, is there a certain fever? And I know this is a parent, especially a first-time parent. Is there a point to where we need to take a trip to the emergency room? Or is it one of those things? Is there a certain fever?
As I said before, it's not so much the fever; it's how the child is acting.
Okay.
Now, however, if you do have a child that has 104 temp, then do take them into the emergency room right away. However, if you have a child that has 100.8 temperature and is not acting very well, that is a child that needs to go into.
Sure.
But otherwise, it's important to go ahead and see your normal physician, because they're the ones that know you the best.
That's right. Now, question here. And, you see movies, you see things, and you hear things. And this actually happened to me. My mom told me when I was a baby, I had 105 fever. We lived out in the middle of nowhere down a dirt road in western Kentucky. And they stuck me in the bathtub and threw ice in an ice bath to bring that fever down. Is that something that still happens today? Is that just old school?
That's exactly the wrong thing to do.
The wrong thing. Way to go, Mom. My God. No.
The reason why that's the wrong thing to do is because the children then shiver and their temperature goes up even higher.
Okay.
So if you have, the first thing you do is go ahead and give them the dosage that's on the box for the Tylenol or Motrin. And then if that doesn't bring it down, then you can put them in the bathtub. But you wash them down with lukewarm water, not ice water. You never use alcohol.
Okay, never use alcohol, because I know that when you do the rub, that alcohol, it feels cold, but you never
You
use
don't
that to
use
bring
the
down
alcohol
fever.
because they can actually become toxic because of the absorption of alcohol.
Okay, all right. Thank you, doctor, for that one. Okay, our next question. What do vaccinations protect my kids from? Haven't most of these diseases already been eliminated?
Well, one of the things that we know about vaccinations have saved more lives than anything else that we have done in medicine. It has saved more lives than the treatments for cancer. It has saved more lives than the treatments for pneumonia or other infectious disease. So vaccinations are extremely important. A lot of these diseases that it prevents are things like whooping cough, which used to be a big killer of newborn infants. And whooping cough has actually returned, and we're seeing it in our adults. So it's very, very important for people to get their whooping cough vaccination if they have a newborn baby in the household. Other things that it protects you against is polio. In our practice, we have several adults that had polio as children. They're now in their 70s and 80s, and they have a weakness that gets worse and worse, as they grow older. Polio is another thing that used to put our children into wheelchairs. It also killed a lot of the children, and you can see pictures of iron lungs, and we have pictures of the old hospital in Plainview where people were put in iron lungs. With various outbreaks that we've had across the country is because we're losing our herd immunity because we are not having as many people get vaccinated for the different types of diseases. A lot of people ask me about the autism link. There is no autism link to vaccinations. That is a myth. And it has been proven over and over again that it is a myth. So, unless you want some of these diseases in your children, it is important to get your children vaccinated. When I first started practicing medicine, we did not have the Haemophilus vaccination. And many a night I was up doing spinal taps on children who had Haemophilus meningitis. We very rarely see meningitis anymore because of the vaccination. Haemophilus meningitis left our children deaf. So there's horrible things that can happen to children that are not vaccinated. It is also very important to get your children vaccinated because to protect those children that are in the community that have leukemia, that are much more likely to catch infections and can die from these vaccine preventable infections.
Let's say we have an adult listening now, and they had one of those parents that did not do vaccinations, did not do any of these things. They've not come down with anything. Is there an age where you reach a certain age to where these vaccinations will no longer work?
No.
Okay.
Well, some of the vaccinations you don't use,
Okay.
like the rotavirus vaccination, which is from a infectious type of diarrhea that is a killer in South America and Africa. That one we don't give past a certain age infants.
Okay.
So there are some of the vaccinations that we don't do after childhood, but a lot of the vaccinations are even given into adulthood, like measles and chickenpox and meningitis, the meningitis vaccination. So they were given into adulthood.
Okay. You've been listening to Discovering Health here on 103.9 FM The Pulse, brought to you by Covenant Health Plainview and South Plains College. We're going to take a few minutes to hear from our sponsors and come right back to have Dr. Rector-Wright answer more questions that have been sent in by you, our listening audience. Have a question you would like have answered? Email that question to askforyourhealth@gmail.com.
Great doctors are right here in Plainview. And leading the way are Covenant Health Plainview Family Medicine physicians Dr. David Wright, D.O., and Dr. Ruth Rector-Wright, D.O. Serving the community for decades with care and compassion, the Wrights have strived to bring only the best care to your family. Visit them at the Covenant Health Care Clinic located at 2222 West 24th Street or call 806-291-5100. Walk-ins welcome.
A new name, a new look, and a new sound. 103.9 FM, The Pulse.
Becoming a healthcare provider takes a special person. If you've ever dreamed of a career where you can make someone smile, keep someone comfortable, or soothe someone's fears, the Health Occupational Division at South Plains College can help open the doors to your future. With a stellar reputation for producing highly sought-after medical professionals, South Plains College is fulfilling the needs of tomorrow through its graduates today. And we provide our students with a quality education at an affordable price. Are you ready to make your dream a reality? Prepare yourself at South Plains College.
Studies show that listening to music on the Pulse 103.9 FM can improve the immune systems of some adults.
Whether you're an expecting new mother or welcoming a new addition to the family, Dr. Charles Smith is here to keep you and your baby healthy and safe. With a vast history and experience in Plainview and the surrounding area, Dr. Smith has delivered generations of West Texans. Visit Dr. Smith and his caring staff at the Covenant Healthcare Clinic at 2222 West 24th Street or call 806-291-5100. Walk-ins welcome.
Warning, listening to 103.9 FM may cause serious side effects such as good mood, happiness, and premature singing out loud.
We are back with Discovering Health, brought to you by Covenant Health Plainview and South Plains College, the radio program that answers the medical questions and concerns that you, the radio audience, have emailed in. In-house, we have Dr. Rector-Wright, family practitioner with Covenant Health Plainview. And let's get right back into the questions, Dr. Rector-Wright. Our next question, dear doctor, what's the difference between the medical student and a resident? Should I trust seeing a resident when I go to a clinic?
It is very important for the doctors, the older doctors, to help train the younger doctors, because you eventually want these younger doctors to take care of you, and so it's important for us to train them well. The medical students come in their third and fourth year of medical school. Medical school is a 4-year program, and when patients are seen by the medical students, they are also seen at the same time by the doctor in the clinic. There's nothing that is done with the medical student that the doctor that is precepting the student does not know about. The residents are people that have graduated from medical school and are in their last 3 years of training. The ones that we have in Plainview are family practice residents, and they are in their second and third year of training. These doctors also talk to the training doctor, which is usually the older doctor in the clinic, about every patient that they see. So even though we may not see the students examine you, we know exactly what they are doing. We are going over all the lab work that they are getting on you. We are making sure that they give you the best of care. The nice thing about having medical students and residents in a clinic is it forces the doctors that have been in practice to make sure that they are at the top of their game and they know exactly what they are doing. So should you trust seeing a resident or a medical student when you go to the clinic? Yes, you should, because they are giving you excellent care.
That's good. And so we know that we've got you looking over all this stuff to make sure. That's right.
Everything. I'm looking over everything that they do.
Sure.
So.
Okay, great. Okay, good question. Next question. Dear doctor, how can I be sure my child is getting a healthy diet and exercising enough?
It is important that if you are worried at all about your child, to ask your physician to show you your child's growth chart at their well child visit. That growth chart will show you exactly where your child is. If your child's weight and height it matches, whether or not the weight is too high for the height, whether or not the height is too high for the weight. And your doctor should be able to tell you whether or not your child should be eating more or possibly eating healthier. It's really important for parents to teach children how to eat. They need to be eating fruits and vegetables and proteins, which are things like chicken and fish and beef. Other proteins can be things like peanut butter and beans. So it's important for them to eat a wide range of foods. What we talk a lot about is for children to eat the rainbow, and that's important for adults too, to eat all the various colors of foods.
And that's not necessarily Skittles.
No,
right?
it's not
that's
Skittles.
That's not the red Skittles.
No,
and the
it's not the Skittles. It's eating all the various colors of fruits and vegetables.
Sure.
Every once in a while, you'll have someone that comes in and says, my child is too skinny. But then when you look on their growth chart, they're exactly the right size. And the reason why people sometimes feel this way is because, unfortunately, the United States of America has gotten to the point where a lot of our children are overweight. So it is important to try to keep your children within the normal weight for their size and for their age.
Sure. And I remember when we used to go in with our kids when they were babies, and little ones under 2, which chart are they in? Are they in the upper level? This and that, And I remember when Grayson was born, I went and watched all these babies, all these newborns in this deal, and Grayson looked like Andre the Giant, laying in this thing compared to the other kids. And I remember coming to you going, man, is he too big, or are we okay? What do we need to do? And you're like, hey, look, as long as he's here, and here, we're in good shape.
That's right. So ask your doctor to look at the growth chart.
Sure. Okay, great. All right. Dear doctor, what is a worrisome rash or dots on skin?
Rashes are not normally a problem unless your child is sick. Now, if you have a sick child that has a rash, a child that is not acting right, not doing very well, that's the type of rash that can be worrisome. Of course, it is important to protect your child's skin by using bug sprays, keeping them out of an area that has a lot of mosquitoes, trying to keep them out of the poison ivy that you may have in the back of your farm. But as long as the children are acting fine, you can take your child into the doctor the next day if you're worried about your child.
Okay, so if you got questions, again, man, schedule an appointment, get in here, let's get it checked out, just to, if for nothing else, peace of mind.
Exactly.
Yeah, sure.
Exactly.
Hey, folks, you're tuned into Discovering Health, presented by Covenant Health Plainview. We need to take a few moments and hear from the fine sponsors bringing you this evening's program, right here on 103.9 FM, The Pulse.
Here at South Plains College, I'm preparing myself for career in marketing. Not only do the small classes make it easy for me to learn, but I'm able to communicate with my friends and the faculty.
With all of our programs, you can jumpstart your career now or transfer credits to a university.
Opportunities everywhere, but not everyone can see it. At South Plains College, opportunities are endless. I'm Austin Villagomez, and I'm preparing myself at South Plains College.
SPC, quality education, affordable cost.
When you need a trusted name in medicine, Dr. Sergio Laura is here for you. For more than 12 years, Dr. Laura has specialized in providing the internal medicine needs of our local friends and neighbors. His experience and knowledge of adult medicine has kept Dr. Laura at the forefront of West Texas healthcare. Visit Dr. Sergio Laura, one of the most trusted names in West Texas, at 2606 Xenia Street, or call 806-291-5120.
The Technical Education Division of South Plains College can help you get into a career in as little as 1 to 2 years. If you want to work in business administration, law enforcement, cosmetology, real estate, or the legal profession, a job can be yours in a short period of time. If your interest is in software development or network technology, that dream can become reality. South Plains College provides our students with a quality education at an affordable price. Explore these career opportunities and many more today. Prepare yourself at South Plains College.
For great music and information on health-related issues, keep it on 103.9 FM, The Pulse.
Surgical excellence is right here in Plainview. Dr. Yildiz and Dr. Raja with Covenant Health Plainview Surgical provides all aspects of general surgery to include abdominal surgery, surgical oncology, gallbladder surgery, appendectomy, critical care surgery, GI endoscopy, hernia surgery, and so much more. Professional and caring doctors right in your own backyard. That's Covenant Health Plainview Surgical. 806-296-7881. We're taking questions with Dr. Ruth K. Rector-Wright, family practitioner with Covenant Health Plainview. The program is called Discovering Health. The mission is to answer questions that have been submitted by you, the listener. Now let's get back to those emails. All right. Dear Dr. Rector-Wright, I am a 65-year-old woman who received the shingles vaccine. Does the vaccine need to be received more than once?
No, as of right now, the CDC is saying that only once in a lifetime. However, the CDC has been known to change their mind, so you might want to check again in 10 years and see if that is still the recommendation. But your family doctor should be able to tell you if you'll need another one down the line. But right now, it's only one shingles vaccination.
Okay. I'd never heard of the shingles vaccine before we, talked about this question. Is this something that you take after you've had chicken pox? Or is this something that you can take before chicken pox? Or
the shingles vaccination is to protect people who have had chickenpox from the chickenpox virus. What happens is as they get older, they lose their immunity to fight off this virus, and they end up getting a rash in a nerve that can cause fairly severe pain. And that's what the vaccination is for, to prevent post-herpetic neuralgia. And so it is important to go ahead and get this vaccination. It is recommended for everyone, people who have had shingles in the past, people who have not had shingles in the past, though they do feel like it works better if you get the vaccination before you get a case of shingles.
Okay. All right, great. Good question and great answer there. Thank you for that. Okay, next question. Dear doctor, should I wake a sleeping baby to feed him?
When you have a newborn baby that's under 2 months of age, they are usually eating when they're first born about every 2 to 3 hours, and then as they get larger, they start eating every 3 to 4 hours. That usually, if your baby sleeps more than 4 hours at night, under 2 months of age, you need to be waking your baby up to eat. However, once they get over 2 months of age and over approximately 10 pounds, those babies can usually sleep longer. Now, when we talk about sleeping longer, we're not talking about sleeping 8 to 12 hours. We're talking about sleeping maybe 6 hours. Okay. However, if you do have a baby that is considered a failure to thrive baby, or one that has just not gaining the weight that they're supposed to be gaining, those babies, you may have to wake them up to feed them throughout the night. But we do try to compress their feeding so that they get more feedings during the day, so that you can get some rest during the nighttime.
Right. That way the parent, can keep their sanity.
Exactly. So.
Okay. Great. Okay. Next question, doctor. I know babies are supposed to sleep on their backs, but mine keeps turning over on his tummy. What should I do?
The reason why babies are supposed to sleep on their backs is because of sudden infant death. They found that the babies that the newborns and the preemies that were put on their stomachs when they were first born had a higher incidence of sudden infant death. And what sudden infant death is when you wake up and your baby is dead in the crib, and for no apparent reason. As children get older, usually at about 4 months, they start rolling. And if your child is rolling and rolling over, then normally there's not a big problem with the sudden infant death, because they can roll themselves back over. It is also very important with the cribs to not put bumper pads in the crib, to not put fluffy blankets into the crib. The babies need to be in sleepers, the zip-up sleepers at night, or when they're smaller, they need to be swaddled. But if you come in and your child is about 4 to 5 months old and they've rolled over in the middle of the night, don't panic. They're doing fine. Sure. They're just progressing and able to roll at that point.
Sure. And when you say that a child, a younger infant like that needs to be swaddled, you mean mean like rolling them up like a tortilla?
Yes.
Right. Okay.
Exactly.
Like rolling them up in a taco to where they're hugged in tight. They're close. And I remember doing that, and that's how I learned how to make my breakfast burritos.
Yes.
Actually, was doing that to the babies. So, okay.
And it's mainly the newborns that need to be swaddled.
Okay, great. And then like you said, so once they hit that certain point to when they can start rolling over, then for the most part, no worries. They're good to go. If they need to roll back over on their back, they can. Okay, well, great. Well, I'll tell you what, folks, it's about time to wrap things up. I'd like to thank Dr. Ruth Rector-Wright, family practitioner with Covenant Health Plainview, for taking time out of her busy schedule to be here with us. If you'd like to schedule an appointment with Dr. Rector-Wright, give her office a call at 806-291-5113 or stop by her office located at 2222 West 24th Street here in Plainview. I'd also like to thank each of you for tuning into this edition of Discovering Health, presented by Covenant Health Plainview and South Plains College. Have a medical question? Maybe you have a concern you'd like to have answered? Drop us an email at askforyourhealth@gmail.com. Dr. Rector-Wright, thank you so much for being here.
Thank you for inviting me.
Yes, ma'am. We appreciate you being here. Hey, folks, for HPRN Network, I'm Chris Moore. Stay healthy, my friends.
You have been listening to Discovering Health, presented by Covenant Health Plainview, with host Chris Moore, and exclusively on 103.9 FM, The Pulse. Do you have a specific problem or question that you want discussed? Email your question to askforyourhealth@gmail.com. And listen in every Wednesday at 5 p.m. for Discovering Health, presented by Covenant Health Plainview. The information discussed on the show are for informational purposes only. The purpose of the show is to promote understanding and knowledge of various health topics. It is not intended to be a substitute for diagnosis or treatment. Always seek the advice of your physician or other qualified healthcare provider regarding a medical condition or treatment. Thank you for listening to Discovering Health on 103.9 FM, The Pulse.
Hey, Dr. Phil here. I help people solve difficult and trying personal problems every day on my TV show, but there's one problem that's just got me stumped: childhood hunger. Nearly 16 million children in America struggle with it. That's 1 in 5 kids who may not know where their next meal is coming from, despite the fact that there's more than enough healthy, nutritious food out there to feed them all. Now, I don't know about you, but that is unacceptable to me. Luckily, the Feeding America network of good people is out there collecting surplus food and giving hope to hungry children and their families at local food banks all across the country. But let's face it, they can't do it without your help. Join me in supporting Feeding America and your local food bank at feedingamerica.org.
Brought to you by Feeding America and the Ad Council. Together, we can solve hunger. Together, we're feeding America.
Adopt US Kids presents Multiple Choice Parenting.
Your daughter just had her first breakup. Do you A, put yourself in her shoes?
How could he do this to you? And for Sheila, she has split ends.
B, console her.
Oh, sweetie, this is going to happen a lot. 4, maybe 5 more times before you get married.
C, take charge.
Got to get this all straightened out. Give a little talking to, man to man, mano a mano. Hey, Steve! Is now a good time? No? Okay, no problem. Bye.
Or D, help her find a new boyfriend.
I know a great place to meet boys. The internet. Nice, single boys. Never mind. How about some ice cream?
As a parent, there are no perfect answers. But you don't have to be perfect to be a perfect parent. Thousands of teens in foster care will love you just the same.
For more information on how you can adopt, visit adoptuskids.org. A public service announcement from the U.S. Department of Health and Human Services, Adopt U.S. Kids, and the Ad Council.
Vicky, how you doing? How's the knee?
It's coming along, doctor, but still some soreness.
Well, let's see. This soon after surgery, some pain is pretty normal.
I was hoping to get more painkillers. The first round worked great.
We're being very careful with those now. Prescription painkillers are opioids, same as heroin. It's easy to start taking them, not so easy to stop.
Last year in America, an average of 40 people died from opioid abuse every day. Long-term addiction has become America's newest health epidemic.
So no pills?
Vicky, you're doing great. So let's try these anti-inflammatories, plus your physical therapy. If the soreness doesn't continue to get better, give me a call.
For opioids, the smaller the dose prescribed and taken, the better. Because even a few prescription painkillers can sometimes go a long, wrong way. A message from the American Academy of Orthopedic Surgeons and the Orthopedic Trauma Association. Visit orthoinfo.org/prescription safety.
Major key alert! Don't ever play yourself. Life is like school. You will be tested, so pass it.
Learn the real major keys to getting to college at GetSchooled.com.
Stay focused. Now that's a major key alert.
Brought to you by GetSchooled and the Ad